A recent survey of women showed that the most common symptoms during menopause that make sex less enjoyable was first, low libido, second was less confidence, and third was painful intercourse. I understand the less confidence piece, as we may not feel as great in our bodies as we did even 10 years ago, but I would argue that our partners are less concerned about the extra padding around our middles and really do want that closeness and intimacy in most cases. The great news is that the women's sexual health industry is listening and developing products to address the midlife sexual experience and boost confidence. Our next guest is an OBGYN who also works for a wonderful company that makes products specifically for women to enhance their overall sexual health. And come to find out, she's co-host of a podcast called Business of the V and the author of the book, The Complete A to Z for Your V. Health, wellness, career, family, life, and the better side of 50. I'm your host, Michelle Folan, and this is Asking for a Friend. Hello, listeners. Good morning. Today's guest is Dr. Alyssa Dweck. She is a board-certified OBGYN and also the Chief Medical Officer at Bonafide Health, which is a provider of naturally powerful remedies for the symptoms of PMS to menopause and everything along the way. Welcome, Dr. Dweck.
Thank you so much for having me, Michelle. It's a pleasure.
May I call you Alyssa?
Please do. I'm not working right now.
Okay. I'd love it if you could just tell everybody a little bit more about you, where you're from, and also where you studied.
I'm a native New Yorker. I grew up in New York in the suburbs, and I now am a Manhattanite, which I love. I went to medical school in Philadelphia at Hahnemann University, which has now been enveloped like so many other health systems and is now called Drexel. I lived there for quite some time. I did my residency there at Lankenau Hospital. I moved back to New York, where I always wanted to come back to, and I've been in practice in Westchester County, New York for the past 28 years or so.
Oh, wow.
I'm a board-certified OBGYN, and thank you for introducing me in that way. I've been seeing patients forever. That is my day-to-day. I'm also an author, so I've written a couple of books. Guess what the topic is? Gynecology and vaginas. Early on, I had an interest in nutrition. In fact, before I went to medical school, I studied at Columbia to do my master's in human nutrition. It's almost a very natural marriage to talk about nutrition and gynecology in the same breath. On the side, I'm an athlete. I like to run. I have 2 grown boys. I have an adorable English bulldog, and my husband and I live in New York.
Fantastic. When we're finished, I would like to get the names of your books and provide that information here for anyone that's interested in your books.
Absolutely.
Oh, that's awesome. I guess my first question would have to be, Alyssa, is how do you do it all? How have you found balance in your life? Because you're super busy.
Wow, that's a good question. I'm one of those people who thrives on drama and excitement all the time. Every so often I'll crash and then revive again after some rest. I also feel like the more you have to do, the more you get done. That's a mantra for me. It doesn't work for everybody, but I really enjoy every aspect of my day-to-day. That's a good balance for me.
I'm in that same camp. I'm more efficient when I'm busier. I started following Bonafide Health after my hysterectomy over a year ago. I needed to find some solutions for vaginal dryness. I have been using Reverie, which is one of your products, for over a year, and I'm a very happy customer. That's how I found you all. This is very organic, you being on the show today, because I really want to talk about this because I know just from my own personal experience that this is an issue. In my reading, what I found, though, was that only about half of women really treat their menopause symptoms.
I'd actually like to suggest that it's probably a lot more than 50%. So many women who are experiencing symptoms, whether they're just uncomfortable or they're incredibly distressing and disruptive or just mild and a little scary because people don't know what's going on, Many of those people do not present to the healthcare system to address these symptoms. The percentage is probably a whole lot higher. I think also that some women don't face symptom treatment because they're afraid. They're afraid maybe that their practitioner won't know how to address it or isn't interested in addressing it. Perhaps they're fearful of what might be recommended, like hormone therapy, which for some people is excellent and for other people is absolutely inappropriate. And of course, there's been some bad press surrounding estrogen therapy over the years. And then I think there's a lack of adequate, credible information about menopause and the symptoms that go along with. People are not necessarily in the know and they might feel like they're a little bit in the dark. But thankfully, that's changing because we're really speaking about this so much more and getting credible, valid information out there for everybody.
Do you find in your own practice, Alyssa, that when you are more proactive and you ask those questions, you can start to get that out of the patient?
No question. Look, a little known but becoming more known secret is that we don't learn a whole lot about menopause or symptoms when we're doing our residency training. We're so busy learning how to deliver babies, how to manage emergencies, how to do a hysterectomy and other surgical procedures. Menopausal symptoms, maybe we get a couple of hours training, but it's really more about learning while we're doing. There's also special training in menopause. I think that practices tend to mature with their providers. We learn more as our practices age and our patients age. And now, yes, I bring it up quite a bit. Younger practitioners who haven't really had a big patient population of menopausal patients may not be bringing these symptoms up that much. And this is something that we're working on as a group of physicians.
You brought this up that sometimes HRT or hormone replacement therapy is not appropriate for everyone. It may be history of cancer.
Yeah.
Someone had breast cancer, whatever. What kind of alternatives, say for vaginal dryness and painful intercourse, what kind of things would you suggest for a patient like that?
That's a pretty broad question. First, I'd like to just address who might not be a candidate for hormone replacement therapy. These can be game-changing medications for many women. I prescribe plenty of hormone therapy, as do many of my colleagues. But a good percentage of women are either not interested in taking hormone therapy or they're not able to for medical reasons. For example, like you mentioned, women with estrogen-related cancers, breast cancer, uterus cancer, they are not going to be candidates for systemic hormone replacement therapy. We'll talk about vaginal hormone in a moment. People who have had a history of a blood clot are not candidates for taking estrogen because their risk may go up too much to have another blood clot or some other cardiovascular event. Women who have migraine headaches with an aura are less likely to be good candidates for hormone therapy because their risk of stroke may be increased. There are a couple of other medical issues that may make estrogen an unattainable option. What else can we think about? First and foremost, for everybody suffering with symptoms, particularly hot flashes, night sweats, lifestyle management really comes into play. Diet. We know for sure there are dietary triggers for hot flashes like caffeine or alcohol or spicy food or large meals or processed food or high sugar containing foods. Exercise is huge. With exercise, we reduce stress, we perspire a lot, so it helps to manage caloric intake and weight, and that type of thing also helps with moods because, after all, exercise increases endorphin release, that good feel-good chemical in the brain, and then stress reduction. Herbal remedies can be very helpful for some people. Some people turn to phytoestrogens, which are plant-based substances that are estrogen-like, and so they may be helpful. Some women turn to other pharmacologic remedies. For example, some of the antidepressants are very helpful and FDA approved and indicated for hot flashes. That doesn't mean menopausal women are depressed necessarily. It just means that these medications may be helpful for hot flashes. There's another medication we borrowed from the neurology world called gabapentin. This makes people groggy. It also helps with hot flashes, so we'll often use this for people who are suffering with symptoms at night. Lastly, of course, hormone therapy works. So for those people who are interested and are game and are medically suitable, we will certainly recommend that as well if needed.
There is that hot flash in the middle of the day that I have friends that said, oh my goodness, you're at work or you're in an important meeting.
Yeah.
And all of a sudden you have this horrible hot flash, and it can be very disruptive.
Oh, it's horribly disruptive. I mainly hear this from people who are professional women who maybe work with many men or sit on boards with men who may not understand exactly what's going on. This can be disruptive not only to personal life, but also to professional life and productivity. And this is where treatment really comes in as something that's necessary.
I was glad you brought up evening primrose oil. There was the other one. Oh, I use magnesium glycinate at night.
Yeah.
That seems to help. I don't know. Is there any data around magnesium glycinate?
There's no data that I'm aware of that specifically addresses magnesium glycinate and hot flashes, but we do know that it may help with sleep. It may help with some of the restless leg type symptoms or muscle cramps. Careful moderation of magnesium is recommended because it's also a cathartic / almost like a laxative effect in some people. You don't want to be waking up at night to have to use the bathroom a couple of times. Just something to think about.
Some of that is not a bad thing in the morning, but not in the middle of the night.
Yeah.
That would be awful.
Exactly.
You brought up antidepressants as an effective means of helping with hot flashes. There's the other side of antidepressants. Let me explain. One of the premises of this show is that I get questions from listeners and also friends of mine. Her question was, she is on an antidepressant. She thinks it's killing her libido.
Mm-hmm. This is not an uncommon complaint. Diminished libido and even orgasmic issues can be a side effect of certain antidepressants. It's always a weighing game because low libido and orgasmic issues can also be a sign of worsening depression. We really have to be careful with managing the depression and managing the medication used to treat that. There are ways to get around this, either with changing dosages, changing the timing of administration of antidepressants, switching to another agent. In fact, oftentimes we'll use Wellbutrin or bupropion as an antidepressant or anti-anxiety agent, but this one is a little bit more prosexual when it comes to the way it manages neurotransmitters in the brain. So this is something that has to be really discussed with both the mental health provider who's providing this medication and the gynecologist as well. There are other ways around it. We can sometimes use herbal supplements to enhance sexual function despite the use of antidepressants. Again, Bonafide makes a product called Restella, which helps to enhance blood flow during the sexual response. And there is a study that we ran to show that it really helped women who are suffering with orgasmic issues because of their antidepressant use. And so women on antidepressants and Restella tended to have an improvement in their sexual function as compared to those just on antidepressants. That's another option if indicated.
Oh, I love that.
Yeah.
That's really interesting. I think there's other psychosocial aspects of menopause that can probably interfere with our sexual health or our libido.
Oh, 100%. Look, libido is complicated for women. It's not just a blood flow issue, although it is a blood flow issue. We need good blood flow to the genitals. It's a relationship issue. If you're not interested in your partner, your libido will naturally be diminished. If you are uncomfortable in your skin, you're not happy with your weight, your tone, or your hair or whatnot, you're going to feel less sexual. If you're super stressed out or worried about privacy because you have kids around or that might hear you being intimate, or if you're worried about finances or you have work responsibilities and thinking about the to-do list, this is going to interfere with your libido. If you have medical issues that are not being managed properly, diabetes, hypertension, all kinds of issues, these things need to be addressed. Yes, there's blood flow, there's medical issues, there's medication, there's relationship issues, there's privacy issues, there's emotional issues. It is a complex scenario.
I know you and I aren't in the business of relationship counseling,
Mm-hmm.
but I do think that having some honest conversation with your partner is probably a good idea at this point, where if you are having issues with libido and interest in sex, also making sure that you're getting enough foreplay to get the motor going That's really important.
You bring up a really good point, and this goes back to vaginal dryness and pain. One big blow to libido is the anticipation of pain. So if somebody is suffering with vaginal dryness due to menopause and doesn't address that, they're going to anticipate pain every time they think about intimacy. That needs to be addressed first. You mentioned using a moisturizer like hyaluronic acid-based inserts, which of course Bonafide makes Reverie. Using this twice weekly on a regular basis and then also adding a lubricant during intimacy can be extremely helpful to prevent pain, and then naturally libido will follow. Other things to consider would be using a vibrator. I know some people are not necessarily comfortable with this, but I tend to frame it as a medical device in my office for the people who might feel a little shy about that, because vibrators are like a massage and they do tend to enhance blood flow to the genital area. So sometimes I'll just write on a prescription pad, doctor's orders, use a vibrator, and that will help to enhance blood flow and also get those juices flowing like you spoke about. Lastly, some couples being directly communicative about activities and what's good and what's not so good anymore will talk about outer course. That means engaging intimately with everything but penetration. Sky's the limit when it comes to that, as long as there's direct communication.
You brought up the vibrator. I had a friend, she called me yesterday. She said, I can't write this down in an email. I need to just call you and ask you this. We can't assume that everybody is in a sexual relationship. She said, is it true that it's a use it or lose it? Will you have vaginal atrophy more quickly if you're not sexually active or using some kind of apparatus like a vibrator?
This is actually a fairly controversial subject right now about the use it or lose it phenomenon. I think there's a lot to it. Look, you have to be comfortable using a vibrator, whether it's for solo play or for use with a partner. I think that surely if you're interested, this will only enhance sexual drive going forward. It will only enhance your experience if you're then subsequently with a partner. It's really personal preference. You can get back in the saddle whether you've used a vibrator or not. It just may take a little bit more emphasis on moisturizers, lubricants, and other methods to help manage vaginal dryness and some of the shrinkage that might occur over time with menopause and lack of use.
Yesterday I had an interview with a dermatologist who does vaginal rejuvenation in her practice. This is when you get to that point where you really need some help, and you may have some stress incontinence along with that. Is that something you all do in your practice?
There are different definitions of vaginal rejuvenation. Mm-hmm. For a typical gynecologist, vaginal rejuvenation might mean surgery, surgical intervention to tuck up the bladder, to tuck down the rectum, to help with procedures that might increase collagen production in the vagina and help with discomfort during sex. Some gynecologists are very interested in doing this, others not so much. We also tend to focus from a conservative methods first and then get more aggressive after that. The usual would be to start with a moisturizer and lubricant, or even consider vaginal estrogen to help with moisture. Number 2, dilators. So dilators are these graduated little cylinders that come in a set. Women are instructed to practice with them to not only stretch the vaginal opening and stretch the width and length of the vagina to help mechanically with this, but also to train the brain to not anticipate pain when penetration is going to occur. So there's a couple of good benefits for this. We mentioned vibrators to help enhance blood flow. We sometimes will use surgical remedies that are minimally invasive, like radiofrequency or laser, energy procedures to help with building collagen production. Although this is not for the faint of heart, and it's not for everybody, and it's typically not covered by insurance. So we have urologists who do this, dermatologists who do this, and inclined gynecologists who do this. And then, of course, there's more intense surgery, which is a whole nother conversation.
Right. I did have a urogynecologist on the show. We did talk about that. I think it's just important that women, if you are having pain during intercourse, you need to find out why. If it is something that does require surgical intervention, you need to know.
Yeah.
Because you can moisturize all you want, and it may not
Yeah, we always inquire during a history when somebody comes in with sexual pain to find out whether it seems like it's initial pain on penetration, which usually suggests dryness or some atrophy, which is not a very nice word to describe this, or if it's deeper pain, which might suggest something completely unrelated to menopause, like a cyst or a fibroid or scar tissue or something of that nature. It is important at least to have it evaluated, and then there are so many different ways to address it.
My next topic I had here was vaginal pH and the importance of maintaining good vaginal environment. Can you address that a little bit?
Absolutely. Speaking about the vaginal microbiome, the community of organisms that normally lives in the vagina, is all the rage right now. Everybody's talking about it. I don't know how it got so on the radar, but I'm glad it did. We speak about the vaginal microbiome being a collection of good bacteria, which are usually called lactobacilli, and not such good bacteria, all others, that remain in a very delicate balance. And when that balance is disrupted, people get symptoms: itching, discharge, irritation, odor perhaps, and sexual pain. Ways to manage this microbiome and keep the pH in the normal acidic range, it's usually below 4.5 for those people who might be testing it at home. There are a lot of factors that go into this, and hormone status is one of them. With hormone loss or estrogen diminished levels, we may see a less acidic vagina. Some ways to help manage this would be using a moisturizer for the vagina specifically, using vaginal estrogen minimally absorbed in the vagina, considering a probiotic that may help to balance the good and bad bacteria again, avoiding things that alter this chemistry, like douches, like really fragrant hygiene products. Even sex can alter this biome, so we have to consider condom use in people who are prone to infection, not to help with contraception, but more to help with maintaining a normal pH. So there is a lot that goes into this, but yes, it's an important topic.
You said something about home testing. I did not know that was a thing.
Oh, yeah. Home testing is, again, all the rage these days, which I think probably was a benefit from the pandemic time where people were really interested in self-care. Home testing can include testing the pH of the vagina. These are little strips that are just pH strips that we've used in medicine forever, and it can tell whether the secretions in the vagina are acidic, neutral, or basic. Neutral and basic are not really where we want them to be. The issue is that you need to know what to do with the results and what might cause false positive or negative results. This requires a little bit of education, and I'll just make one caveat. Blood and semen are very alkaline. So if you've had recent semen exposure or you have any blood in the vagina, you can't really count on your pH strip to be particularly accurate at that time. The other home testing that's gaining popularity is microbiome testing, where a swab is self-administered. It's sent out to a lab, and there are multiple companies that do this, and you get a report of what your microbiome looks like. Of course, this is a window in time. It might be that what you test one day and what you test a week later may look very different because there are so many influences to the microbiome. Nonetheless, people are really interested in data about themselves. This is just another option for people to decide whether something may be off or just right.
And I think if you've had consistent issues over the years, this may be a great way to get a handle on it. You can monitor your own habits and see what affects it.
No question. Now, look, I don't want to put my practice out of business. I think it's very important to keep in mind that you need to have an action plan for whatever results you see. And if somebody is having symptoms of concern, hightail it over to the gyno, and then you can combine that information with your home testing to come up with a plan if necessary.
I am so glad I asked that question.
I am too.
I was not in the know.
But I want to make mention, not all probiotics are the same. So there are probiotics that are specifically geared towards gut health. They've been around for a while because we know there's a gut microbiome. And there are probiotics that are geared towards feminine health. Some have been studied better than others. Some we know get to the vagina. with oral administration. Bonafide Health does make an excellent and very well studied probiotic called Claire V. I will mention that, but do your homework if you're going to consider something of this nature.
I will put all the products in the show notes so everybody will have those handy.
Of course.
There are the wonderful changes that we have. We tend to get a little chin hair. Maybe our hair and skin aren't quite as lovely as they were. I'm sure your patients ask.
Oh, all the time.
What do I do? What do you usually tell them?
I'm not a dermatologist, but much of this concern is due to hormone change. There are, again, lifestyle factors that have to be taken into account. Wear sunscreen. Hydrate very well. Use an amazing moisturizer on the skin. I get a lot of concerns about hair loss, particularly on the head, and some about hair growth, but more about hair loss on the head. And I think that there are a few things to consider. There are supplements, particularly containing biotin. In fact, Bonafide makes Sylvessa, which is a system for hair and skin, does contain high-dose biotin, which might be helpful. The hair serum has been shown in studies to increase hair growth, but this is a slow go. You're not going to put it on a couple of times and then wake up in the morning with a new lustrous full head of hair. Realistic expectations are important. Sometimes there really is a true hormone imbalance that needs to be addressed by a physician, like a thyroid abnormality or some increased testosterone level or male hormone androgen level that needs to be addressed in a different fashion. Once again, if you're losing huge clumps of hair, please check it out with your dermatologist or gynecologist, and then you can consider some supplements from over the counter or other remedies that are more medicinal. One thing that's little known, because so many women wear a really tight ponytail, particularly if they're exercising or something of that nature. Give your hair follicles a break, loosen it up a little. That may help also to prevent hair loss if it's something that's chronic.
That's actually really good advice. One I need to follow myself.
I hear that a lot.
Ever since the pandemic, my hair's been up. Everybody now, when they see me with my hair down, I was like, oh, I washed my hair today. That's why it's down. Testosterone.
Mm-hmm.
We didn't really talk about testosterone replacement, but I know when we do testosterone replacement, because I do a very low dose of testosterone.
Sure.
That women automatically think, oh God, I'm going to grow a beard. I'm going to have male pattern hair loss.
Right.
How do you confirm people in regard to their fears?
Right.
That they're going to be okay?
Well, for the most part, testosterone use in women is not an FDA-approved medication. I think that's important to note.
Correct.
I typically will prescribe testosterone in low doses topically for my patients who are trying to help enhance their libidos, and I haven't found another medical avenue to pursue or a medical problem to address, or even a psychological or emotional issue as we spoke about. Yes, side effects of testosterone, especially in high doses, can be acne, can be hair growth in typical male places, can be hair loss, especially around the frontal area hairline, can be an enlarged clitoris, can be aggressive behavior and mood. I monitor testosterone levels in blood in order to make sure I'm not providing too much, but clinical symptoms are going to let me know whether my dosing is too much or too little. There are some providers who will supply pellets or injections or other measures to provide testosterone along with other hormones or even testosterone precursors like something called DHEA. Again, this is not really my wheelhouse and not really approved by the typical governing boards that I subscribe to, like the American College of OBGYNs or the North American Menopause Society. But testosterone supplementation is something that we use in low doses to enhance libido as long as it's monitored. So I think I'll leave it at that.
I guess it's important to note, too, is that when you do use testosterone, you're not trying to get to the levels that a man would be.
Oh, goodness, no.
It's in a very tight window of, and I don't know the exact number.
It varies by lab, but it's more about the clinical scenario. If I put someone on a dose of testosterone as a topical cream, let's say, and they come in for the follow-up that I recommend, which is usually 3 months after initiation. And even without blood work, if there's hair growing on the face or significant acne, I've had people come in with an enlarged clitoris. There's too much going in there, and I'm going to make decisions based on that with my patients. As long as it's closely monitored and people are making an intelligent decision that's well-informed, knowing that this is not FDA approved for women, I think that's a conversation to have with a healthcare provider. But there are a lot of nuances. And again, I do rely on blood levels to monitor that as well. Because after all, our usual adage is above all, do no harm.
Correct. And I think this brings up another topic, is the fact that there isn't an FDA approved testosterone product out there for women.
There used to be, I hate to date myself, but there used to be a wonderful combination estrogen and testosterone product. It was discontinued a while back and people still miss it. At this point, again, there are approved FDA medications for libido for women. They have their own limitations, but testosterone is not one of them.
Do you find, Alyssa, that we're getting better? Are we getting more research done in women's health?
I think so. I'm inundated with research to read. I can't even get through it all. But of course, does it approximate the amount of research done on male sexual health? I would probably say no. We're getting there.
I'm glad to hear you say that. Like to see that change because it's so important.
Mm-hmm.
It's part of our psyche and our well-being to have people like you and companies like Bonafide Health that are championing women and saying, hey, listen, we know this matters. I think it's fantastic.
Thank you. I will mention this because I think listeners need to hear this because I know my patients do. There is no normal when it comes to your sexual life. It's what's normal for you and what's distressing or not. So, for example, I will see patients who say, I'm having sex 3 times a week and I'm miserable. My libido is bad, this, that, and the other. Some women who will say once every 2 months and I am thrilled. So there's no normal. If somebody is distressed with their sexual health, bring it up to your gynecologist, and if they can't manage it, they'll send you to somebody who can. But don't compare yourself necessarily to the Joneses because everything varies and is individual.
I think that's a great place to wrap up.
Sounds good to me.
I love it. Thank you so much for being here. Again, I'll put everything in the show notes. If you think of anything between now and when the show comes out, just let me know and I'll add it.
Absolutely. There's so much to talk about. We could talk for 10 hours, but I think you covered so much ground.
Well, thank you so much for being here. I look forward to chatting with you again soon.
You bet. Take care.
Thanks. Follow Asking for a Friend on social media outlets and provide a review and share this show wherever you get your podcasts. Reviews and sharing help us grow.